Today's date is January 20th, 2015. We're here with Kristen. Kristen came to see me last week, and she had a diagnosis of pelvic inflammatory disease, also known as PID. And you've given me consent to video you and post you on YouTube. Is that correct?
Yep.
And energetically, I found a problem in the fallopian tube, which is common, which would be the source of infection for PID.
Yeah.
Now, you had been to other doctors, correct?
Yes.
And what did they do?
They did an interior pelvic exam and an exterior pelvic exam and took cultures and gave me antibiotics.
And what did the antibiotics do?
Well, I don't know. They
didn't fix you,
They
obviously.
didn't fix. No, it was over. I mean, by the time I saw you, it had been over a week of, or it had been a few days of taking them, and there was almost no reduction
change
in pain.
Right. And tell us about your pain, please.
There was pain in the ovaries, which was throbbing pretty much all the time. Couldn't
Yikes.
sit down, stand up, laying down. Everything was uncomfortable. And then there was also pain in my mid-abdomen. So right there, and then down here in the ovaries. It was throbbing. It would also come and go in acuteness of pain, but it was always there.
Bladder issues?
Having a full bladder meant that there was not only the sensation of a full bladder, but it was also pressing on everything else, which made the
Which would
entire
make it
abdomen
worse, right?
painful. Yeah.
In other words, for the viewer, you not only have the sensation of a full bladder, but since it was pressing on inflamed organs like ovaries and other structures, it hurt.
It hurt, yeah.
And on a scale of 10, with 10 being the worst pain and 0 being no pain, what did you walk in the door with?
I'd say probably about a 6.
That's very significant.
Yeah.
So what we did with you, for the viewer, is you permitted me to do a pelvic injection transvaginally, which meant that we did a routine pelvic exam and we put a needle through the wall of your vagina on each side at 4 and 8 o'clock, and we administered ozone.
Yep.
We did not even use a local anesthetic.
Nope.
You were a brave woman. Did it hurt?
Yep.
Did it hurt a lot?
Not unbearably.
No. And it went away after, what, 30 seconds or 60 seconds?
I'd say more like 30.
30, thank you.
Yeah.
And it was gone, okay?
Yeah.
So then what happened to you after, no local anesthetic. The viewer
Right.
needs to know that. We usually put it in to reduce the discomfort of the ozone, but in your case, just because of certain situations, we decided not to.
Right.
And what happened by that night?
The pain in the ovaries was gone. It was feeling totally normal again. Some pain still in the mid-abdomen, but that went away after about 2 days. And that night I could sleep on my stomach again without discomfort and pain. A full bladder just felt like a full bladder again. Yeah, it's kind of amazing, actually.
Thanks. And you told me when I just spoke with you a few minutes ago, there's no pain now. Is that correct?
True.
How many days ago did we do this?
A week ago.
Okay.
Yeah.
And how many days are you pain-free?
Since Thursday. So 5 days?
5 days.
Yeah.
Would you recommend this to others?
Yep.
Okay.
Yep.
Thank you. I want to thank you for sharing your intimate story here with other people. That was very kind of you.
No problem.